This presentation is of deep personal significance for me. Today I want to share with you real incidents of 1986 when a woman endured severe vomitings for about 6 months during her pregnancy. She could barely keep down any food. The only meal she could retain was a small portion of curd rice in the supper. But even that was challenging because if she did not fall asleep in next 15 minutes, she would bring it back. She would vomit it up. I had never witnessed any woman experiencing such severe vomitings in my life before that. This relentless condition took a toll on her life, causing her to lose weight. Her gynecologist prescribed her a medicine known as pyridoxine, which unfortunately did not have any effect on her. Eventually, she gave birth to a baby boy, who was weighing only 2.1 kgs. In 1986, my knowledge was confined to only allopathy because that was the only sole field of medicine in which I received a formal training. In the year 2021, our daughter became pregnant. She too started experiencing severe vomiting, something similar to her mother's ordeal. However, over the years, I gained knowledge about potent medicines that effectively managed her vomitings with a single medicine with a single dose. This medicine was both robust in controlling her issue of vomitings, yet very gentle on her pregnancy and her fetus. Remarkably, this medicine not only resolved her problem of vomitings, but it managed all the 12 challenges she faced during her 9 months course of pregnancy. This personalized constitutional medicine helped her, made a crucial role in helping her to deliver a healthy baby through normal delivery, weighing a healthy weight of 3.4 kgs. This remedy also has remarkable efficacy in preventing abortions, which her constitution was highly prone for. This information, this knowledge are shrouded in secrecy, hidden from the views and knowledge of millions of doctors and billions of people. I am making this video with the hope that it reaches as many people as possible. The woman who became pregnant in the year 1986 was my wife, Dr. Bharati Devi. Myself, Dr. Sudhakar Reddy Tirupati, pediatrician with more than 30 years of experience in modern medicine and 14 years of experience in homeopathy. I have a channel on YouTube by name Try Incurable. Today I want to talk about a common problem known as morning sickness, nausea and vomitings of pregnancy. At least 80 to 85% of people experience this problem. But many women can have almost no symptoms, but some women suffer very seriously. Particularly in about 3% of pregnant women suffer with what is known as hyperemesis gravidarum, means severe vomitings causing them to lose weight and dehydration. They may need hospitalization also. So when your friend enjoys the first trimester, you know the real struggle, what the real struggle is. When you have tried every remedy to stop morning sickness, but you're still controlling your life. The reality is there is a scarcity of medicine, particularly in modern medicine, there is a scarcity of medicine. Just think logically why there is so much of scarcity of medicine for the safe medicines. Because if any wrong medicine is given, it is immediately shows the side effect in the baby. That's why there is a scarcity. Doubtful efficacy. As I already told you, safety is the issue and it cannot address the root cause. Let me talk to you the story of doxylamine and pyridoxine. Most commonly used medicine and most commonly studied medicine. This medicine was introduced in the United States in the year 1956 with the name of benedictine, containing three medicines: doxylamine, pyridoxine, and dicyclamine. Dicyclamine is a pain relieving drug. This was removed from the group in the 1976. In the year 1983, this medicine was withdrawn from the United States market. The reason? Lawsuits, too many lawsuits. The cost was amounting to $10 million. The revenue for the company from the medicine was only $3 million. After withdrawing this medicine, many people, they didn't have any medicine for the control of nausea and vomitings, and there is a lot of economic burden. Because for the treatments and also for the hospitalizations. So in the year 2012, one study was done which calculated this economic burden, which was amounting to $1.7 billion, equivalent to 170 crores in Indian rupees. The question is, who pays this money? Anybody knows who pays the money in America? So in the year 2013, this medicine was again reincarnated. It is again introduced into the market with another trade name, but with a caution. We do not have a robust safety profile for this medicine. US FDA says this drug is not known to cause birth defects, but studies to prove its safety for the developing fetus have not been performed. This was published in drugs.com in January 2023. But in the year 2019, another study done by National Institute of Health in Canada has shown that there is a new evidence for concern over the risk of birth defects from medications used to control nausea and vomitings. Story about doxylamine and pyridoxine, I'll talk again little later. But right now, I want to talk about how I am going to manage or tackle the problem of morning sickness, where I do not mean to give tablets every day, injections, intravenous fluids, or hospitalizations. I do not mean to give very subtle or modest effective medicines. What I mean is the medicine which treats the root cause, which is given once, works for weeks together, safe in pregnancy in all 9 months, very powerful on issue of nausea and vomiting, but gentle on pregnancy and fetus. The success of treatment depends on its individualized application rather than a one-size-fits-all approach, what I call wholesale approach. And when you realize that every person is a unique snowflake, and so are their remedies, each person is different. The action is marked by doubt and is characterized by minimal and short duration effects of all these medicines, which are prescribed mostly these days in any part of the world. Let us talk some details about this doxylamine, how safe it is. When it is given to a breastfeeding woman, it is easily excreted in the breast milk and it can cause drowsiness and irritability in the breastfeeding infant. This medicine, doxylamine, which is an antihistamine, it was used for short-term treatment of insomnia, that is sleeplessness. Can it be given to 3-year-old child? No, it cannot be given to any child under the age of 12 years. It can cause serious side effects and even death in young children. Then what about its safety in pregnancy? This is about the study done in Canada by National Institute of Health. It has shown that first trimester use of doxylamine, pyridoxine and metoclopramide was definitely associated with major congenital anomalies. This metoclopramide was very popularly prescribed medicine about 25 years back, which was very popular for causing extrapyramidal reactions, very stiffness in the different parts of the body. Hardly anybody prescribes. And one more interesting thing about this combination doxylamine, pyridoxine, very widely prescribed by in any corner of the world, is that statistical data shows that there is increased risk of spina bifida. Do you know what is spina bifida? Just see in the next picture. The statistics says the AOR, adjusted odd ratio, should be around 1. If anything more than 1, there is definitely increased risk of side effects. The AOR was 1.87 for spina bifida and musculoskeletal defects was about 1.08. So this is what a spina bifida, how it looks. So how safe is another drug known as ondansetron? So this medicine pharmacokinetics in pregnant women were not characterized. Pharmacokinetics means the way how it is absorbed, how it is excreted, all those details. Is it safe for the babies? No, it cannot be given to children below 4 years of age. And one interesting thing about this ondansetron is it immediately crosses the placental barrier. Very fast it crosses the barrier. But in the neonatal period, it is excreted very slowly from the baby. So what I am going to talk about the medicines which are safe in pregnancy, which are tested and trusted for more than 2 centuries and their effectiveness remains unchanged. Your doctor may not have access to this information because it falls outside the scope of their medical training, and they are quite safe in pregnancy also. So when you finally discover a cure for morning sickness, definitely every woman wants to be your best friend. I did encounter hyperemesis gravidarum, where nausea and vomitings are very severe, leading to dehydration and weight loss. I am right now treating one woman who encountered this problem in her second pregnancy. Now she is in third pregnancy. I am treating her now. I do not say that all the symptoms are under control, but most of the symptoms are in the reach of the medicines. Her symptoms are relatively better now, which I am going to talk afterwards. So those who know the root cause, they treat it. Those who do not know, they muddle around in bushes. Individualized treatment is crucial for addressing symptoms instead of one-size-fits-all approach. The management of morning sickness mainly depends on 2 factors. Number 1 is how the stomach manifests, what are the symptoms are there in the stomach. Number 2 is how the vomitings are. I will talk about the stomach symptoms first. Symptoms are exact, treat the exact cause, treat the root cause. The symptoms in stomach commonly faced by women in pregnant women are there can be burning in the stomach, there can be cramps in the stomach, there can be flatness or gas in the stomach, or some women typically feel emptiness sensation, particularly in the morning time. They feel the same emptiness sensation even after eating food. Some women complain of fullness sensation. Some people may complain of pain in the stomach. They may have sweet belching or accumulation of water in the stomach with cramps, or they may feel as if stomach is going to burst, or there may be heartburn. Then coming to the vomitings, in some women nausea may be more than vomiting. Some women may have vomiting of frothy water. Some may have frequent attacks of severe vomitings, first food, then mucus, and finally blood. Vomitings may be persistent. Persistent means they don't want to give up. They don't want to give up. Persistent vomitings, or they may be long and continued or protracted vomitings for longer periods. Some women may feel sick, particularly while walking. They just want to lie down on the bed. The vomiters may be bitter or it may be sour. It may contain water, particularly sweetish water before breakfast. They may vomit in the forenoon or after supper. The vomiting may be associated with retching. We have to take each and every symptom into consideration. If still not able to come to some conclusion about the medicine, study the constitution of the woman and give the constitutional remedy. And usually it solves most of the problems. I want to share some of the examples of nausea and vomiting, how I treated. First example of in the year 1986 about my wife. I already told you how she suffered. In the year 1986, like the millions of doctors understanding nausea, vomiting and pregnancy, I also understood the same thing, nothing more. And millions of women continue to endure unnecessary suffering due to a lack of awareness and the absence of this crucial information among treating physicians. I was no exception in the year 1986. Then about my daughter, her typical symptom was, key symptom was emptiness in the stomach. That was the main feature of her constitutional medicine. And not only that, vomiting, it resolved all the 12 challenges she faced during her course of pregnancy and delivered a healthy baby weighing 3.4 kgs. This is the example of another woman from my family. The key symptom was vomiting aggravated by eating fruit. She consulted me on 28th July 2023. In 11th week of pregnancy, she already lost 1.5 kgs weight. Her main symptom was nausea while eating or after eating and aggravated by eating fruits and empty stomach. Her constitutional medicine, pulsatilla, almost cured all the problems. She never required second dose. So let me talk of another example of hyperemesis gravidarum. This is the story of woman. In 2016, she became pregnant in the year 2016, but unfortunately, she aborted in 5th week of pregnancy. As I already told you, some constitutions are highly prone for abortions. This is one of her important constitutions prone for abortions. In 2017, she again became pregnant, but vomitings were so severe, particularly after 3 months. She used to vomit every day, at least 10 times a day. And at least 2 times in a month, she used to have blood vomitings. Imagine a woman in your family, a pregnant woman, having a blood vomitings. And every day she used to take this combination tablet, doxylamine, pyridoxine, doxinate or pregnedoxin before every meal. Zofer tablet, not controlling vomiting. She used to take Zofer injections, only relief for few hours. Next day, same scene. She was given even Rantac also, because she was having burning and flatus problem. So one positive side effect of medicine used for nausea and vomiting pregnancy, at least these 3 medicines, Sepia, Kali carbonicum and pulsatilla, they have efficacy of preventing abortions at least in 30% of pregnant women. In 5th month, circulage was done, means they put a sutures around the cervix so that abortion will not happen because of pressure of vomitings. Our expected date of delivery was 2nd September, but vomitings were so severe that gynecologist induced artificial delivery on 31st August. She was continuously vomiting even in the delivery room. She vomited during delivery and after delivery also. Her vomiting was always preceded by cough. Nobody observed that symptom. The reason was not known. So finding the correct remedy for morning sickness, how it feels, I need not explain. She became pregnant 3rd time in the year 2023. Her key symptom is vomiting preceded by cough. Medicine Sepia cured her problem of empty sensation, and some other symptoms were treated accordingly. She is under my treatment. Compared to her first pregnancy, at least there are no blood vomiting so far. She is in 3rd month now, and hospitalizations are not there. And most of her symptoms are under control. Not that totally disappeared, but she is under treatment. She is in 3rd month. I cannot give final picture now. So match your symptoms, not medicines. Take the medicine under supervision of a constitutional expert. Share and help millions of pregnant women suffering because of ignorance of this knowledge among lay people and doctors as well. Please subscribe and share if you think this is useful information, useful to you or your near and dear. And please understand, this presentation is not for any therapeutic purpose, it is only for educational purpose. Thank you for watching this video and thank you for your time. Thank you very much.